Hello! I'm here today to talk to you about what happens during and after a colonoscopy procedure. So what exactly is a colonoscopy? A colonoscopy is a medical procedure that allows the doctor to look inside your colon and rectum for problems such as ulcers, inflammation, bleeding, polyps, and tumors. During the colonoscopy, a tool known as a colonoscope, which is a thin, flexible, tubular device, is used. The colonoscope is inserted into the anus and into the rectum before being carefully guided up through the colon, all the way to the cecum, and often enters the very end of the small bowel known as the terminal ileum. The colonoscope's front tip features a video camera for sending images to a computer screen for your doctor to evaluate. In addition, the scope has a light as well as irrigation and instrument channels. The irrigation channel is used to flush water or fluid into the colon to remove debris, so the doctor can get a clear view of what the inside of your colon looks like. A colonoscopy, which usually takes 30 to 60 minutes, is performed by a trained gastroenterologist. Prior to the procedure, you'll be given a sedative, so you can relax, and afterwards you'll be placed on your side. As the procedure begins, your doctor will carefully insert the colonoscope into your rectum and advance it to the end of your colon or cecum. A small amount of air may be blown into your colon to help expand the passageway so that your doctor can obtain a better view of a particular area or abnormality. This can make you feel pressure or mild cramping, which can be eased by taking slow, deep breaths. Over the course of the procedure, a video from the device will be playing on a monitor so your doctor can examine the colon lining thoroughly. The video can be recorded, and the doctor may elect to take photos for further review and analysis. Later, as the procedure concludes, the colonoscope is slowly withdrawn while the doctor carefully examines the lining of your bowel. If your doctor finds polyps or suspicious areas during the colonoscopy, the polyps will be removed, and small tissue samples will be taken to be biopsied and checked for signs of cancer. And just a brief word on polyps. They're usually not cancerous, but they can change to become cancerous, which is why it's important they be removed. Polyps are removed with biopsy instruments or wire loops that are passed through the scope into the colon using a technique called snare polypectomy. The polyp is surrounded by a wire loop, and then an electric current in the wire burns off the polyp. The polyp is then pulled through the instrument channel and collected for biopsy. The good news is that polyps contain no nerves, so you won't feel any pain during removal. After your colonoscopy, you will be taken to rest in a recovery room until the effects of the sedation wear off. You may feel some gas or cramping, but this will quickly pass. Before you are released, your doctor will share the results of the colonoscopy with you. If a biopsy was sent to the laboratory, it may take a few days or longer to receive the results. Your doctor will also provide instructions on the follow-up care required at home and how to recognize complications in case they occur. Depending on the number and size of polyps found, as well as the quality of the bowel cleanout, your doctor will recommend when your next colonoscopy should be done. Because of the sedation used during the procedure, you should prepare to have a family member or close friend drive you home. Also, you'll want to take the rest of the day off and not make any major decisions for 24 hours. If a polyp was removed, or if a biopsy was performed during your colonoscopy, there is a very small risk that you may have small amounts of blood in your stool for a few days afterwards. However, if you experience severe abdominal pain, fever, dizziness, or continued heavy bleeding from your anus, call your doctor right away. As always, please discuss any questions you have about your colonoscopy with your doctor. After all, your doctor is there to help you through the process and answer any questions you may have. By providing this information, our hope is that you'll feel more confident and empowered in the days leading up to your colonoscopy, which again is generally a safe procedure. Thanks for watching.